Hello everyone, myself Dr. Chaitanya. I'm gonna discuss on respiratory distress. So before starting the respiratory distress, the principle to define the respiratory distress, few principles are there. There should be a tachypnea, there should be a use of the accessory intercostal muscles and main respiratory muscles, cyanosis and grunting. So, what is tachypnea? We have to define the tachypnea. The tachypnea means the fast breathing. So, it is basically differ on the basis of this age. Say, if newborn baby is age of 2 months, then it's if respiratory rate is more than 60 per minute, then it is called as fast breathing or tachypnea. So if child is 2 months to 12 months, then if more than 50 breaths per minute, it is called as fast breathing. So if child more than 12 months up to 5 years, if it is more than 40, it is called as fast breathing. So use of the accessory muscles. So some accessory muscles, you should know the name of the accessory muscles like sternocleidomastoid muscles, other like natal flare and tracheal torque. If it is present, use of these muscles, only muscle is sternocleidomastoid muscles, and the other feature like natal flare and tracheal torque, then it is called as use of the accessory muscles of respiration. So use of the intercostal muscles like or subcostal muscles. This is another feature principle for the fast breathing. Respiratory distress. So other feature like audible cry and cyanosis. Audible cry and cyanosis. This four feature constitutes a definition for respiratory distress. So what is apnea? Say apnea is a cessation of breathing for more than 20 seconds with or without bradycardia or cyanosis. With or without bradycardia or cyanosis, it is called as apnea. So cessation of the respiration for less than 20 seconds, if it is associated with the bradycardia and cyanosis, it is also called the apnea. So if like cessation of the breathing for 20 seconds with or without bradycardia or cyanosis is called as apnea, and if like cessation of breathing is less than 20 seconds, there must be a presence of cyanosis and this bradycardia. So apnea is basically common in the neonates in the age of like second day to fifth day of life. So because immaturity of developing brain, it is responsible for apnea. So important cause for the neonatal apnea are like say hypoglycemia, metabolic acidosis and hypothermia and the prematurity. These are the associated feature for the apnea. So what are the pulmonary cause of neonatal respiratory distress? So basically the three topics are very important. Most of the time in examination they ask like respiratory distress syndrome, which is a stroke, and syndrome, hyaline membrane disease. Another name is it can called as this is a hyaline membrane disease, and another is meconium aspiration syndrome, and another is transient tachypnea of a newborn. These three entities are very important. So we'll discuss further on this three topic on the basis of clinical feature X-ray finding. So other feature like pneumonia, transient tachypnea, which is persistent pulmonary hypertension, congenital malformation like transient tracheoesophageal fistula, diaphragmatic hernia, lobar emphysema, and pulmonary hypoplasia, and use of airway obstruction, upper airway obstruction like choanal atresia, vocal cord palsy, lingual thyroid, and pulmonary hemorrhage. These are the pulmonary cause for the respiratory syndrome. So next, so what are the causes for the respiratory syndrome, respiratory distress with the mediastinal shift in the neonates? So this is basically differential. You should memorize. It is helpful during your the clinical posting. So diaphragmatic hernia, congenital lobar emphysema, congenital mediastinal mass, pneumothorax, congenital cystic the adenoid malformation. These are the these causes for the respiratory distress with the mediastinal shift. So let's start with the meconium aspiration syndrome. So what is meconium? Meconium is basically the first stool of the infants. So it is composed of the material ingested during the infant spends in the utero. So interstitial epithelial cell, lanugo, mucus, amniotic fluid, bile and water it consists. So meconium aspiration syndrome occur when infant take the meconium into their lung during or before the delivery. It's called as meconium aspiration. So more common in the post-term neonates, but also occur in the term also. So what are the consequences for the meconium aspiration syndrome? There are three main problems facing due to the meconium aspiration. So one thing is the obstruction emphysema or atelectasis. When aspirated material blocks the airway, it's called as it can lead to meconium aspiration. Another is pneumonitis or chemical pneumonia. So because of the irritant property of the meconium, so that can lead to this meconium. So another is the defective gas exchange. These are the main consequences that can lead to the meconium aspiration syndrome. So what are the clinical manifestation for meconium aspiration? So basically the respiratory distress within 1 hour, there may be tachypnea, retraction, grunting, cyanosis, overdistension of chest. These are the clinical features present during the respiratory distress. So what are the complications? So respiratory distress syndrome, pneumothorax, persistent pulmonary hypertension, flattened diaphragm, and increased anteroposterior diaphragm of the chest. These are the complications leading during the meconium aspiration syndrome. So another disease is the hyaline membrane disease or respiratory distress syndrome. We'll talk this hyaline membrane and respiratory distress syndrome on our next topic of discussion. Thank you, everybody.